There's a little story of nurses standing at the bottom of a river, pulling bodies out. Lyle went up to the river to find out who was throwing them in. Hi everyone, this is Group 8 from the Saskatoon campus, consisting of Jenna, Brittany, Amanda, Anna, and Emily. Today, on February 7th, 2020, we will be talking to you about a little-known Canadian woman who had a very big impact on the nursing field, Dr. Lyle Creelman. Lyle was a unique leader in the nursing world from 1936 until her death in 2007. We will start by discussing how her beginnings created a foundation for Creelman to think on a global context. We will then describe how Creelman changed Canadian nursing through both her national and international contributions, and we will conclude by illustrating the changes we see daily in nursing that were influenced by Creelman's leadership.
Born in Nova Scotia in 1908, Lyle Creelman was the youngest of 11 children. Due to the differences in age between Creelman and her siblings, she was essentially raised as an only child, which was an unusual upbringing at the time. In 1920, the family moved to Stevenston, BC, a fishing port southwest of Vancouver. This resulted in Creelman being exposed to Asian, First Nation, and European fishers. It is here that Creelman saw racial discrimination happening firsthand to the Japanese population.
Creelman finished high school with the highest marks in the province and received a one-year scholarship to the University of BC, where she completed 1 year of a liberal arts program. She initially planned to study medicine, but after her father died, funds became limited and her plans were derailed. Instead, Creelman attended the Teachers Training College. She worked as an elementary teacher for 2 years to save up for further education, and she gained knowledge along the way about the barriers of race, gender, and privilege. This background in education would form the foundation for her nursing style. In 1932, Creelman was finally able to enter the UBC nursing program just as the focus of nursing was beginning to shift from treating disease to promoting overall health.
In 1936, Creelman obtained her degree in public health nursing from Vancouver General Hospital School of Nursing, and she began her public health career in Revelstoke, BC. Not used to the small town, Creelman had to adapt her teaching methods. She found herself constricted by the local school board, the local physicians, and the parents who often resented public health nurses telling them how to raise their children. But Creelman was persistent, and she learned how to create alliances with local authorities and how to adapt her teaching to suit the locals. This experience would help Dr. Creelman in the future, working with larger populations and much bigger organizations.
In the fall of 1937, Lyle Creelman was appointed to the Metropolitan Health Committee of Greater Vancouver. This was the first health unit in Canada to adopt an amalgamated approach that allowed one nurse to provide families with several services that targeted medical, physical, mental, social, and psychological needs. After only 8 months in the position, her superior died suddenly, and Creelman was asked to replace her. Concerned about her lack of experience, Creelman requested a 1-year sabbatical to further her education. Thanks to a Rockefeller scholarship, she was able to attend Teachers College in New York and learn about senior-level nursing administration.
For the next year, Creelman completed her Master's of Nursing at Columbia University in New York. Throughout this year, Creelman became captivated with her academic courses and public health fieldwork. The fieldwork that Creelman conducted exposed her to the dangerous work and house conditions of Black and immigrant women. Creelman was learning in a progressive school that pushed students to become less complacent and to become more defiant of outdated educational models. Working alongside some of the most innovative nurse educators of her generation pushed Creelman to adopt a progressive way of thinking. In 1941, Creelman returned to Vancouver to reform and expand the city's public health nursing services. She was appointed Director of Public Health Nursing at the Metropolitan Health Committee of Vancouver. During this time, she tried to provide better nursing care to the Chinese and Japanese communities in Vancouver, but was working against a system that was prejudiced against Asian Canadians. The effects of the war were beginning to be felt in Canada, and nursing leaders were becoming increasingly worried about shortages of nurses. More and more nurses were volunteering for military service, and Creelman was one of them.
To broaden her professional field, in 1944, Creelman accepted an offer to work with the United Nations Relief and Rehab Administration. This was the beginning of Creelman's role in global nursing. The decision to work abroad forced Creelman to put any plans she had for marriage on hold. After serving abroad with the UNRRA for 1 year in England, Creelman became chief nurse in the British zones of occupied Germany. During her time in Germany, she witnessed firsthand the human suffering that was going on in the war. She began to organize nursing services to help care for the people of diverse nationalities who have been displaced from their homes during the war.
By 1946, World War II had ended, and Creelman returned to Vancouver, where she started working for the CNA and the Canadian Public Health Association. During this time, she co-wrote the Bailey-Creelman Report, which established the guidelines used to direct public health in Canada. The report assessed the status of public health nursing in Canada and made recommendations for improvement. Her ideas were controversial at the time, but their impact is still seen in today's public health model.
In 1949, Creelman moved to Switzerland, where she lived for the next 19 years, working with the World Health Organization. After accomplishing so much in the British war zones, Creelman was personally recruited by the WHO Director General himself. During her time in Switzerland, she became an advocate for primary health care and its sustainability in developing countries. She became a nursing consultant in maternal and child health and was named Chief Nursing Officer. A major accomplishment of Creelman's time at the WHO was the creation of the nursing section. The section allowed for the status of nursing to improve in physician-dominated world. Her interprofessional connections allowed for greater authority and self-regulation. Creelman continued to work with the WHO and traveled to Central America, India, Asia, New Zealand, Africa, and Europe. Her first-hand observations of the difficulties WHO nurses faced when implementing their programs led her to pioneer a transcultural approach to international nursing. Her work valued diversity and self-sufficiency in healthcare of individual countries.
As Chief Nursing Officer of WHO, Creelman also had to adapt her management style and try new strategies to recruit qualified nurses and establish a sense of shared identity within the international nursing community. Creelman created a secret service of nurses who were allies located in strategic positions throughout the WHO system to provide regular assessments of WHO's position in various countries. The Secret Service provided insights into local political and financial conditions that inhibited WHO health programs within a country. In this way, Creelman was able to guide the direction of nursing within the WHO on an international level. Creelman was a strong advocate for the improvement of primary health care delivery and sustainability. She was an advocate before Alma-Ata, 1978. Creelman was exceptionally receptive to the needs of local communities. She was a highly respected figure, and nurses around the world consulted her for advice and support. Some authors described her role as a cross-cultural broker or a catalyst that changed the face of international nursing. This was the period that Creelman reached her peak of influence in the world of nursing. In 1958, 155 WHO nurses served in 44 countries, which made up 1/5 of the total WHO field personnel, owing it all to Creelman. The nursing section has expanded over the years and now includes the promotion of nursing research.
Creelman formally retired in 1968, yet she continued to devote her life to global nursing. She died in 2007, childless and unwed.
Dr. Lyle Creelman was considered unusually well educated for a woman born in the early 1900s. This, as well as her background in education, may have underlined why she viewed formal university-based education as not only an important aspect of personal growth, but essential to promote change in a complex society. Although Creelman is now regarded as a nursing leader who had a meaningful impact on the nursing field, throughout her interviews, she continued to describe herself as an educator first. She did not, however, view nursing education as static. Through her influence on the international nursing field, Creelman's legacy lives on as having promoted primary health care with an emphasis on sustainability prior to the 1978 Declaration of Alma-Ata. Her experience in community nursing and nursing on a global scale helped her to understand that education could and should be tailored to the needs of the country. Through her global experience, Creelman's influence on Canadian nursing laid the groundwork for advancements in preventative medicine and health education. After exploring Creelman's nursing journey, we have learned that leadership requires the courage to stand up for the change you want to make.